Greetings, everyone. Good morning and good afternoon from whichever part of the world you are joining. Uh, I will now request Dr. Hyun from WHO to welcome all the participants and introduce the speakers. Dr. Hyun, over to you.
Yeah, thanks, Mr. Sakshin. Good morning and good afternoon to all esteemed officials from the Ministry of Health line ministries of the member states in the Southeast Asia region, WHO country office colleagues, supply chain professionals from the partner agencies, academia, and private sectors supporting the response to COVID-19 pandemic. On behalf of WHO Regional Office for Southeast Asia, I would like to thank each and every one of you for being here with us today for this webinar workshop on the COVID-19 supply chain preparedness and the response in 2021. COVID-19 pandemic is challenging all health systems and health supply chains are no exceptions. The rising number of the cases and their demands on the healthcare systems, together with enhanced testing strategies, have resulted in the shortages of the basic items such as the test reagents and essential COVID-19 supplies globally. Due to severity and the suddenness of the pandemic, countries in the Southeast Asia regions, like elsewhere in the world, have struggled in all areas of procurement and supply chains of the COVID-19 commodities. International procurement has been a major challenge with limited supplies vis-à-vis demand. International trade and logistics have been severely constrained due to transport restrictions as a result of the lockdowns and then export restrictions. Even within countries, lack of trained manpower, systems, processes, and the infrastructure for handling the emergency supply chains has created additional bottlenecks and inefficiencies. Many of these challenges already existed for the regular health supply chains during the routine times, but the emergency response has amplified the shortfalls and the impacts during this global pandemic. In order to strengthen and build a more resilient procurement and supply chain system in the regions for the ongoing COVID-19 response, as well as the future pandemics, WHO, in collaborations with the Global Outbreak Alert and the Response Network and the Empower School of Health, has provided extensive procurement and supply chains management assistance and support to countries in the regions since the onset of the pandemic. Today's workshop is being organized by WHO SEARO in partnership with the GOARN and the Empower School of Health. And the main objective of this workshop is to help the member countries in the Southeast Asia region to take a fresh look at the planning of the COVID-19 supply chain response for 2021, including the addition of the COVID-19 vaccines to the existing COVID-19 commodities. The cross learnings between the SEAR countries from the experience in the 2020 during the workshop will actually help the countries to adopt the best supply chain practices in the new year. For today's excuse me, for today's workshop, I would like to introduce the facilitators, starting with Professor Andy Baraklov, Director of the Learning and Development from the Empower School of Health, Mr. Sakshin Jagtab, Head of Supply Chain Consulting from the Empower School of Health, Dr. Sidi Khanal, Technical Officer of the Immunization and Vaccine Development Unit from the CRO, who will also be taking us through the session on the global landscapes of COVID-19 vaccines and the cold chain logistics. And lastly, but not the least, Dr. Victor Del Rio Villas, Technical Officer of Global Outbreak Alert and Response Network from CRO. And also, in the interest of time, I would like to request all the participants to introduce themselves in the chat box. And I would like to request all the participants to kindly mute their mics and raise any questions in the chat box that we will try to address and answer as many as possible within the given time frame during the workshop. And all the unattended queries, we will revert back to you at the earliest after the workshop. Once again, I would like to express my sincere thanks to all the participants for your valuable presence today and the valuable inputs and interactions during the workshop. Thank you so much.
Thank you, Dr. Hyun. And with this, I will invite the next speaker, Dr. Sudhil Khanal, who will talk about something which we have been looking forward to right from February last year when this pandemic broke out. Something which is very important and which will have a big impact not only on the COVID supply chains, but the overall health supply chain. So with that, Dr. Sudhir Khanal, uh, kindly take the floor, and you are co-host, so you can unmute yourself and present your screen as well. Thank you.
Thank you very much. A very good morning, good afternoon, and good evening to everybody wherever you are. And thank you for this opportunity to talk in the workshop. Let me update my slides if you allow me a moment. So while the workshop is more on the supply chain, I'll be focusing on a small component of the supply chain, which is on the cold chain and logistics, but very relevant as countries are rolling out COVID-19 vaccines into the national programs. I hope everybody can see my screen. If somebody could confirm.
Yes, Dr. Sudhir, we can see this. We can see your screen.
Thank you very much. So talking about the vaccine landscape and going directly into the agenda point, as the time is limited, as of 18th of January, we have 291 candidate vaccines in the pipeline, of which 68 are in the clinical trials and 10 are already in use. So we already have 10 vaccines that are already in use. And which are those 10 vaccines? These are 10 vaccines, most of you know which are these. The mRNA vaccines from Pfizer company, which has been approved in 50 countries, approved by 50 countries, and is also the only emergency use listed vaccine by WHO at this point of time. And then we have this mRNA vaccine from Moderna and a non-replicating viral vector vaccine from the Camellia Institute called the Sputnik 5 or the Sputnik V. And then we have the non-replicating viral vector vaccine AZD 1222 from Oxford AstraZeneca, which is approved in 8 countries. Then we have a similar vaccine from Serum Institute of India called Covishield, which follows the Oxford AstraZeneca technology and is approved in 2 countries, India and Nepal. And then we have a vaccine, inactivated vaccine from Bharat Biotech, which is called Covaxin in India, approved only in India. Then we have 2 vaccines from Sinopharma, which are both inactivated. The first one approved in 7 countries, second one approved in 2 countries. We also have a Sinovac, inactivated vaccine from Sinovac called the CoronaVac, which is approved in China, Indonesia, Turkey. And and then we have another peptide platform vaccine developed by the Vector Institute, which is called Epivac and approved only in Russia. Well, number of vaccines have been approved in number of countries, but they don't mean that countries have actually implemented them. So as of 17th of January, around 49 plus countries have already started COVID-19 vaccination, and around 0.5% of the global population have already been vaccinated. The latest addition is Indonesia. So we only have 2 countries in Southeast Asia region that have already implemented vaccination, COVID-19 vaccination activities. Those are India and Indonesia. But if you see the list, this list is mostly governed by countries, high-income countries. So for equitable access of the vaccine, WHO, UNICEF, Gavi, CEPI, and other partners have come up with the COVAX facility to ensure equitable global access to COVID-19 vaccine. And this COVAX facility envisions that they will provide 20%, provide eligible COVID-19 vaccine to 20% of the prioritized population in the member states, and around 92 countries have already signed into that. The 20% vaccine will be provided as 3%, 7%, and 10% to priority groups. And as of today, the COVAX facility portfolio has 3 vaccines: the Oxford AstraZeneca, Sanofi, GSK vaccine, and the Serum Institute of India. Serum Institute of India will be producing Novavax as well as Oxford AstraZeneca vaccine. So we have limited portfolio, but we are assuming that the portfolio will expand every day And this is a very rapidly evolving field. So every day the information are rapidly changing. But as of today, COVAX facility have only these 3 portfolio vaccines. Uh, However, to introduce vaccine from the COVAX facility or any vaccine, WHO has recommended, WHO, UNICEF partners, and World Bank, we all have recommended a COVID-19 vaccine introduction readiness assessment tool. We also call it as the VIRAT or the VIRAF tool to assess country readiness, and it gives a clear guidance to countries on what are the components the countries should be preparing for when they are introducing COVID-19 vaccine. And it has 10 components, and the component of interest to us, well, everything is of interest, but for the sake of today's meeting, the interest is on vaccine cold chain and logistics. So I'll be focusing more on that component. The vaccine logistic and the cold chain component um, has 8 indicators in vision for preparedness, and I would like to read them out. The first one is to establish or strengthen the National Logistic Working Group with appropriate terms of reference. That helps to, sorry, sorry for that. So the first one is about strengthening the National Logistic Working Group, and the second one is to map the key roles and responsibilities needed for vaccine and ancillary product deployment, collect and confirm contact information for key personnel and facilities. The third one is more to create a distribution strategy, including the mapping of potential ports of entry, stores, and fallback facilities in the country with the respective cold chain storage for 2 to 8 degrees centigrade, -20 degrees centigrade, and ultra cold chain requirement for -60 to -70 degrees centigrade, and transportation capacity. The fourth one is to map and develop plans to provide for infrastructure needs, including for energy backups, IT communications, and water. The fifth one is to assess dry storage and cold chain equipment storage capacity and infrastructure that are needed at all levels with regards to the COVID-19 vaccine characteristics, and to fill the identified supply and logistic gaps. The sixth activity proposed is to provide appropriate SOPs, protocols, or guidelines for collection and disposal of waste materials. The seventh activity is on update and implement systems and protocols for tracking the stock management. It's mostly stock management, the distribution of vaccines and key supplies through the existing logistic management information system. And the last one is to disseminate delivery and acceptance protocol, ensure monitoring arrangements, and identify supervisory focal points. These 8 activities are clearly defined and more described in the vaccine deployment plan, and the countries have already been provided with the vaccine deployment plan. So where are we with these 8 components in the Southeast Asia region? So if we look at these 8 components, we have information from 9 countries. We have 11 countries in the WHO Southeast Asia region, and we have information from 9 countries. Thailand is not, Thailand is a self-procuring country, and so not eligible for the COVAX facility. So we have not included them, and we have no information from DPR Korea. Of these eight activities, these are the level of preparedness that we have. The green ones mention that the activities for preparedness have been completed. The yellow one says that the activities are in a maturity stage and they are in the verge of completion, whereas the orange ones are basically saying that the preparation have been started, but they are in the early stage. And so if you look at the scorecard of the 8 activities, 51% of the activities in the region have been completed, 28% are in the maturity stage, and 11% are in early stage, and we have no information for 10% of the activities, all from one country. So in gist, we can say that there's a significant level of preparedness in the region for the countries, and special focus is on the cold chain. So we've also done a cold chain capacity assessment in the Southeast Asia region countries. The Southeast Asia Regional Office also conducted an orientation of personnel involved with vaccine supply chain management and monitoring on the tools and resource planning for preparing cold chain capacity for COVID-19 vaccine. This was conducted in the first week of November 2020. So some of the key findings from this assessment was that the review of cold chain capacity said that all countries All countries express confidence to have cold chain capacity, which is adequate and manageable for 20% of the population for vaccine requiring 2 to 8 degree temperature. And none of the country had adequate cold chain capacity to even cater for 3% of population for vaccines that require minus 20 degrees centigrade storage. But then they could work on it, and they could ensure that is available within the next 2 to 3 months. Similarly, no country had cold chain capacity for vaccines requiring minus 70 degree temperature, and countries ensured that they would go back and explore on the locally available cold chain storage at private market mm, or other possibilities. We also oriented countries on two important tools related to cold chain. One is called the supply chain sizing tool, and the other is the cold chain equipment inventory and gap analysis tool. These tools will help to identify what are the current gaps and what are the costs that would be required to fulfill these gaps. This will also give a good idea on the current inventory of the cold chain system in the country. So this is also an opportunity to strengthen the existing cold chain system irrespective of COVID-19 to the countries. And the outcome of these tools are required for countries to apply for the COVID-19 vaccines and also for support for cold chain equipment to the COVAX facility. The COVAX facility provides an opportunities for the countries that they would provide some grant to the countries to strengthen their cold chain. And they have asked for a rolling submission of the applications, and at least to our knowledge, 4 countries have already submitted the application, and we have the ceilings for each country on how much is the country eligible for the amount of support from COVAX facility. So 4 countries have already submitted, and most countries have plans to submit, and we hope that countries will use this opportunity to strengthen their cold chain system, cold chain equipments and logistics system. So some of the key points for consideration in terms of cold chain and logistics for COVID-19 vaccines are the first and the foremost important is vaccine availability. Vaccine currently has become a political commodity. It is yet to be a public health commodity or a commercial commodity. So we really don't know what vaccines will be available to which countries. As of today, the global market has already pre-ordered 10 billion doses of COVID-19 vaccines, 10 billion doses, which is already exceeding the current production capacity for 2021. So we are in a dire situation that we have to depend on those who have already pre-ordered the vaccines to get vaccines for our countries. So we also don't know what are the properties of the vaccines, but what we know is we would be receiving at least 2 categories of vaccine, either vaccines that can be stored at 2 to 8 degrees or vaccines that can be stored at minus 70 degree. And we know that the vaccines will not be bundled, so the countries will have to ensure the diluents and the syringe needs. So countries will already have to explore the need for syringe. We also don't know about the shelf life of the vaccines, and these vaccines will come with QR codes. The QR codes will have to be scanned in the secondary package to know what are the expiry dates. And normally most mobile phones or cell phones, Android phones or iPhones would have these facility to scan these QR codes and get the details on the vaccines. The second most important thing on the storage temperature and cold chain capacity, especially on the ultra cold chain. As I mentioned earlier, if we get vaccines for 2 to 8 degrees centigrade, that is not a big issue. Most countries are already using that cold chain in the routine immunization system. But if it comes to ultra cold chain and dry ice, which is for the Pfizer vaccine, which is the only vaccine that is emergency use listed by WHO, then there has to be some preparations that country will have to do. At this point of time, procuring ultra cold chain would require at least 3 months of time, and we don't know if we will be using these for other vaccines in the future, at least in Southeast Asia region. So countries are reluctant to build their ultra cold chain capacity. However, there is an option of using dry ice. So how do we use dry ice? Because dry ice is also hazardous, and there are occupational hazards related to dry ice. And a number of countries may not have the capacity to produce that dry ice, and they may have to get it from the neighboring countries. So it's important to consider that if ultra cold chain if the country is planning for a vaccine for minus 70-degree temperature, they should also look into for ultra cold chain, and if not, as a backup with dry ice. Uh, this is important because WHO, through its COVAX facility, have requested countries if they are interested to have asked countries if they are interested to introduce this Pfizer vaccine, which requires ultra cold chain. And a number of countries have expressed interest. At least 6 countries in the Southeast Asia region have expressed this interest to introduce a small quantity of Pfizer vaccine as first wave countries. So these 6 countries will have to make sure that they either have their ultra cold chain capacity or have the dry ice production facility and handling of the dry ice. The other issue to be considered is the vaccine management and documentation system. We need to ensure that the recording and reporting formats are of appropriate type. They record the right doses. The issue with current COVID vaccine is they come in 2 doses. The first dose would be recorded, but then we have to ensure that the same person gets the second dose, same vaccine of the second dose of same vaccine and are appropriately recorded. We need to prevent dropouts. And also countries should discuss about the formats for issuing vaccination certificates, because they need to be printed out uh, and transported to respective vaccination sites. Um, Transportation is another challenge because continuous temperature monitoring for ultra cold chain, we do not have much experience on that, and we'll have to ensure that we have data loggers that can continuously monitor minus 70-degree temperature if we are getting ultra cold chain vaccine that require ultra cold chain capacity. Transportation is also important in the context because this vaccine is very precious. It is not giving blanket coverage to everyone, but everyone wants this first. So there is a chance of spillover to unwanted, unprioritized group. There are also chances of loss, chances of theft, chances of robbery. So transportation should also ensure that there is a lot of security involved so that we don't lose the vaccine or get spilled over to unprioritized group. Uh, we also need to consider the management of vaccination site, where we have to ensure adequate physical distancing. The infection prevention measures are well considered, and use of PPEs. Another point is waste management, which is a big challenge and of big concern to people working on the logistics program. How do we dispose the vaccine vials? How do we dispose the syringe? How do we dispose safety box? And especially the PPEs and other waste, how do we segregate them and dispose? Because they're going to come in big volumes. At least for 20% of the population, a number of countries don't have that experience on how to manage that amount of waste generated to vaccinate 20% of the population. So we will need to have clear plans based on the country policy, either to incinerate or burn and bury, or whatever is the national policy. Um, the issues with information system and communication mechanisms are there. We've seen that some countries started web applications, uh, and they thought that the web application would provide messaging to the countries, but then how do we optimize them, and how do we ensure that the server are not down or the server don't get hanged during the process? And then the last and the most important thing is the orientation of the health workers and vaccine handling and management. How do we orient health workers? Well, it would be easy for vaccines that come for storage temperature of 2 to 8 degrees, but if we have vaccines for minus 70 degree, there are a lot of training needs because this is something new for the health workers. I think these are a few things that we need to consider. And I just wanted to make a few points on Pfizer vaccine, because cold chain requirement for Pfizer vaccine, because this is something that is proposed in the first wave countries that have expressed interest to receive small quantity of Pfizer vaccine to introduce COVID-19 vaccine in their countries, and at least 4 to 6 countries in this region have expressed their interest. So the Pfizer vaccine does not come with diluent, they don't come with reconstitution syringe, and they don't come with vaccination syringe. So if the countries are receiving these things, the Pfizer vaccine, they would have to ensure that the reconstitution syringe for at least 2 ml, 2 ml reconstitution syringe, and at least 0.3 ml or 1 ml with multiple graduation vaccination syringes are available. The training need is different. especially on the ultra cold chain, as I mentioned earlier also. Uh, if there is no ultra cold chain facility available in the country, the vaccine comes in temporary thermal containers, and the vaccine still can be stored in these containers up to 30 days. So the Pfizer companies ships the vaccine in these thermal containers, and these thermal containers can themselves be used as ultra cold chain store to store the vaccine up to 30 days. However, every 5 days the dry ice will have to be changed. So the country will have to ensure that they have enough dry ice to replenish every 5 days. And the challenge is availability of the dry ice. How do we handle and dispose dry ice? It's easy to dispose dry ice, but if we don't know the mechanism, there could be occupational hazard. And then how to ensure that the Pfizer vaccine is given in 2 doses. We cannot give the first vaccine with 1 dose and the second dose with another vaccine. We don't know the interchangeability of the platforms of the vaccines currently available. So we would like to ensure that the same vaccine is given in 2 doses to the recipients. I think these are a few key points I want to highlight. And to summarize, more than 49 countries have started COVID-19 vaccination. And with the current global effort, most countries are bound to get the COVID-19 vaccine sooner or later. So we better start to prepare for the supply chain and logistics. Countries are fairly prepared for introduction of COVID-19 vaccine as per the VRAT-VRAF tool. However, the specific cold chain and logistic details based on the type of vaccine the country would introduce into their program is yet to be worked out. And the COVAX facility provides opportunity to countries to strengthen cold chain and logistics through the cold chain equipment application windows, and we encourage those countries that have not applied to apply for this window of application for cold chain equipments and logistics. Thank you, and let's discuss. Over to you.
Thank you, Dr. Sudhir. I think that was short but very insightful. And I think when we see that 0.51% of the population in the world is already vaccinated, that's really interesting. I think it's really commendable, the work that the scientists have done. So the base is there. I think the scientists have done their job. The planning and preparedness is there. I think the 8-activity framework is it looks very, very powerful. And I think that's a good tool, which the countries, as we can see, are already using. Now, I think is the job for us supply chain professionals to make sure that the distribution, the logistics, the deployment plan is executed, and that we can go from 2 to 11 countries carrying out vaccinations, and hopefully large bulk of our population can be vaccinated in the next few months. So we will have a Q&A round later. But if there are any burning questions, please post them here in the chat, and maybe Dr. Sudhir can take them up right now. Otherwise, we'll of course have more questions coming later. Okay, so I think while some of you, if you can think of any questions and while you post them, what I'll also do is I have a very exciting announcement to make before we proceed further. So let me just share my screen. Yes. So we'd also like to take this opportunity to announce the Emergency Outbreak Response Platform. Many of you who are registered for this webinar have also been registered for this platform. So what is this platform about? So essentially, what we are trying to do is we are trying to create a community around this platform. We hope to have dozens of professionals, hundreds of professionals from South Asia and Southeast Asia on this platform. This platform will give an opportunity for you all to network with each other, to learn from each other. We'll also have mentors to guide you, to provide you technical assistance. There will be a number of courses. Most of them will be free courses, which you can take and build your capacity around outbreak response, pandemic response. All this is focused on supply chain. The highlight of this platform will be a course on managing COVID-19 commodity supply chain. So that will be also introduced on this platform shortly. Now, this platform is currently in the beta stage, but we'll soon share links with you so that you can actively participate in this platform. Other than this, when you log into this platform, you will find a lot of resources, tools, reports, white papers. You'll also find the collaborative tools such as discussion forums, chats. So we hope that this platform will not only help us to fight against the current pandemic, but also to prepare us for any future pandemics. So with that, I'll just see if there are any questions. Okay.
Yes, we have a question on disposal of unexpired, unused vaccine, expired, unused vaccine.
Yeah. So, Dr. Sudhir, would you like to answer this question? So this is a question from Bhutan, from Mimi Lamu. And the question is, any specific instructions on disposal of unused expired Covishield vaccine, which is genetically modified?
Yeah, thank you very much. I think every country has its own national mechanisms on how they dispose their vaccines. All vaccines are GMOs. Same for Bhutan and other countries, that these vaccine will have to be expired as per the will have to be disposed as per the national policy. And in most countries, the national policy is in some countries they put it to the incinerator. In other countries, there are different mechanisms, but it goes with the usual, like the usual vaccines. The way the routine immunization vaccines have been disposed, this the same way will have to be used by the countries, and it's different for different countries. Thank you.
Thank you, Dr. Sudhi. I think there's a question about sharing the PPT. So this webinar is being recorded, and I think while joining, permission was sought from you that we are recording this webinar. So this recording will be made available. So for those who joined late, can go back to the recording. And any further questions or queries that you have, you can, of course, reach out to us, and we will be happy to answer, or contact the speakers and facilitators, so that you can be provided any further details and insights. So with that, I will now request Professor Andy Barraclough to start his interactive session on managing the COVID supply chain in 2021.
Okay, greetings, good morning, good afternoon to all. Thank you very much for being with us. As I make the presentation, I will invite Dr. Rabin from Nepal and Mr. Om Prakash from Maldives to make presentations, so that it's not just listening to my voice all the way through. If we look at the current health supply chain situation, we have a problem because we don't have a lot of hard evidence. Whilst a vaccine cold chain has been assessed for our general public health systems, supply systems, maturity assessments are generally not available in most countries. Key performance indicators, when they are measured, are often not reported regularly. Overall, it's perceived that our public health supply chains are weak. It's certainly known they have been chronically underfunded and under-resourced for many years. Further, this movement to reduce cost has made them brittle. We have sacrificed resilience for efficiency. So they are no longer as resilient as we would like them to be in the public health sector. If we look at the results of the survey that was conducted in 5 countries in Southeast Asia, we see that whilst epidemic planning is in place in all countries, epidemic planning for PSM, for procurement supply management, is generally not well developed and not easily available. We've undertaken the clinical aspects of epidemic planning, but we haven't undertaken so well the PSM aspects. And supply chain maturity measurements, how well are our supply chains doing, where are the key bottlenecks, are not well documented and evidence-based. One of the problems around the epidemic is the emergence of a large number of fake and substandard COVID-related commodities. Huge number. Over 60 countries have reported incidents. In France, they found products from over 90 countries available. Interpol has had a major operation to try and control this huge rise in fake and substandard products available on the market. If we look at the graph, we see that in mid-year of 2011, we really hit the peak of substandard and fake products, not just COVID-related products. All medicines, all health products were involved in various frauds and various substandard productions. So we have to be particularly on our guard at this time. The effect of the pandemic on the international supply chain has to be increased the amount of substandard and fake product which is available. Further, if we look at the overall non-COVID commodities, we see again, also with Interpol, major increase in the amount of substandard medical products, especially pharmaceuticals and medicines, which have emerged on the market. 4.4 million units of illicit pharmaceuticals in various raids and across the board, from anabolic steroids, analgesics, dermatology agents, vitamins, all items have been subject to a rise in substandard and fraudulent products. Also, if we look at what's happening to manufacturing, the UK, considered to be a stringent regulatory authority for medicines. Because of the COVID pandemic and the effect on staff availability, has allowed flexibility to manufacturers, that is mainly pharmaceutical manufacturers, so that retesting of raw materials is limited. Transportation no longer needs to be in temperature-controlled vehicles. Qualifications and validations can be extended without full inspections. The overall effect of this is to lower the level of regulatory control on manufacturers, and that's from a stringent regulatory authority. You shouldn't take it too seriously. Most of these are minor, but we should understand the impact on reduction in regulatory control that's occurred during this pandemic. The pandemic has a widespread implication on all aspects of our public health supply chain. I'd ask now Dr. Rabin Gautama from Nepal to share some of their experiences. Dr. Rabin, if you can unmute, please.
Yes, thank you, Professor Andy. Can you hear me now?
Yes, a little bit soft. If you can increase the volume, that would be good.
Okay, sure. Thank you very much once again. So I'll try to share my experience from Nepal. And good afternoon, everyone present in this forum. So regarding the country experience for Nepal, initially I just want to briefly highlight about the context in which we began our program with. Initially, we had a planning done for the COVID supply and the procurement and management of COVID supply for around 1,500 cases. And now we have come around 267,000 cases as of 18th of January. So we've come a long way in the last 8 months regarding the number of cases that we have seen in this country, as well as the kind of planning that we have done for the to handle this number of cases in this country. As of now,
sorry, Dr. Rabin, if you can come a little bit closer to the microphone, it's a little bit soft for everyone here. I think.
Okay, now is it okay?
That's better, thank you.
That's better, okay, thank you so much. Sorry for it. So as I said right now that we've come a long way since planning for the 1,500 COVID-19 cases to 267,000 COVID-19 cases. We've had a long process in terms of planning and procurement of the COVID-19 community, as well as seeing the supply chain management in this country as well. For now, we have almost 98% of the total cases have been recovered. And as of the latest data, we see that the number of patients, number of people admitted in the ICU as well as in the ventilators has decreased drastically over the last 1.5 months before it was fully utilized in this country. And initially, when the COVID-19 response began, we had only one COVID-19 testing laboratory. Now we have around 22 RT-PCR testing laboratories. And you can imagine the kind of stress as well as the pressure it puts on the supply chain management. Despite this, I think we've done reasonably well in terms of managing the commodities for the different laboratories as well as for the hospitals in this Next slide. So just to say that currently we only have a very few areas in this country where we have the number of active cases, which is highlighted in the red column. Basically, is the capital in this country and the surrounding 1 or 2 districts. Otherwise, I think we've seen the number of cases drastically decrease over the last few weeks in this country. Next slide. Just to highlight some of the supply chain response to COVID-19 in Nepal, I think one of the things that we initially began was establishment of the one-door mechanism for any kind of COVID-19 commodities that are supplied by the partners, as well as for any COVID-19 commodities that are received in this country. It followed through one-door mechanism. I think this helps significantly in terms of the kind of, the distribution mechanism, as well as the commodities that has been received. It given a clear insight regarding what was currently present at a particular time. This particular mechanism was really helpful in the country when the COVID-19 occurred. Similarly, we had a procurement as well as donation of the COVID-19 items that were received in this country. As you know, that Nepal transitioned to the federal structure recently, so we had proper stores and distribution of the COVID-19 commodities at different levels, and this was not that difficult. But despite the different, despite the federal structure that we had in this country, I think a lot of COVID-19 commodities that was distributed actually was through the federal system, not from the provincial or the local system, but it was mainly from federal system. So there was a lot of pressure on the federal system, but despite this, I think we did reasonably well in terms of managing the commodities at a different level in this country. And we also had a rapid expansion of quarantine solutions as well as the laboratories that I highlighted earlier. Next slide. So I think one of the key experience has been that we actually had a very difficult having information from the different, because we transitioned into a federal system, we had a very difficulty having information from the different levels because that system was not really organized. I think that made a very difficulty in terms of forecasting, procurement, and distribution plan for the COVID-19 commodities. So what is a good practice that really occurred in this particular time was that the electronic logistic management information system was rapidly scaled up at the subnational level in 2020, which was a big success in terms of that it was very easily and very successfully implemented in the provinces and the local government, which then had an impact in the sense that we started receiving some sort of information from the provinces, from the hospitals, from the labs, although from the local government, it is still in work in progress, but from the 3 or 4 main areas from the provinces, hospitals, and labs, we've been able to receive the information. And this has helped us really to plan things a little bit more easily than it was in the initial days of the COVID-19 outbreak. Go to the next slide, sir.
Sorry, it's very difficult to hear. Can the speaker be louder, please?
Yeah, I'm sorry, I think I just have a break in the microphone.
Okay.
Sorry for it. Yeah. I think now you're able to hear me. So we had a rapid expansion of the ELMI sites, electronic logistic management information sites, in 2020, as you can see in the graph as well. So as of 2020, we've covered almost all the levels, all the subnational levels in this country for the reporting mechanism. So the COVID-19 commodities also has been, kept into the system of the ELMIS, which has resulted in the information flow from the different levels to the national level. On to the next slide, sir. So another experience I think as highlighted by Professor Andy, I think one of the key challenges was on the quality of the commodities that has been procured or that has been received through donations in this country. We had a lot of difficulty in assuring the quality of these commodities. Although we do not have any particular specific mechanism, but I think we had an intervention of keeping a technical specification bank, which allowed to maintain some sort of quality in the sense that the commodities had to be maintained as per a certain criteria as mentioned in the technical specification bank. Similarly, another body was also established, which is given responsibility to prepare the standards for COVID-19 commodities. And this was the intervention that was carried out. And as far as possible, the impact was that the technical specification bank was referred in terms of the commodities that has been received in this country. But however, I think one of the biggest challenges in this country has been how do you actually test the kind of commodity that has been procured or received, because we do not have a testing mechanism, although we can specify the criteria, but how do you ensure that this particular commodities, example, mask or any kind of commodities, maintains those particular criteria that has been lacking in this country. I think this has been the key experience of Nepal for now. So I think we can move on to the next slide. And this is all that I have to say from my side. Over to you, Professor Andy. I'm sorry for my sound because I think.
No problem. Thank you very much for being with us today and for sharing that information. It raises many interesting points, but I feel that we should push on, and we'll raise those in the Q&A section just shortly. Okay. So thank you very much, particularly about the one-door system and how to operate in a decentralized supply system. I think are key points for many countries. We'll come back to those in the Q&A. As well as the quality issues we've talked about, there's also major disruption to the supply chain, not just for COVID-19 commodities. For all of our public health commodities have been affected in some ways. If we look at the latest report from the Global Fund on their commodities, they are putting the disruption level at moderate, with delays of around 30 days on orders, and lead time for PPE products by air at 3 months. This is a little bit difficult to read, but if you look at the predicted lead times from the Global Fund, I hope you can see if you wanted high volume ARVs for delivery in May, well, you should have ordered them in November. The earliest delivery you're now likely to get ordering in January is in July. 6-7 months away. This is the impact of COVID on lead times worldwide. Not just COVID commodities, all medicines. Similarly, if we look at TB medicines, these are indicative lead times from GDF, the Global Drug Facility, for the supply of TB medicines. And once again, we can see that if you want delivery before July, it's problematical. Most of the July deliveries are for this ordering this month. Again, 7 months lead time on the medicines. And that means a major change. We need to start ordering products now if we want them to be available. Coupled with that delay is the delay in transport. If you look at the latest UNICEF report on the transport requirement, the blue graph is the cargo availability, which has dropped by 30%. So the availability has dropped, and as UNICEF reports, the price has increased highly. It has stabilized a little bit towards the end of this year, but it's still high and capacity is still lower. Part of that lower capacity is because of the reduction in passenger flights. Passenger flights also carry some cargo, and on the red graph, you can see passenger movements have reduced massively, and that's contributed to the loss of cargo delivery. So even when the products are available at the manufacturers, it's more difficult, more timely, and more expensive to transport them. I'd now ask Mr. Om Prakash from the Maldives to share with us their experience from the Maldives, please.
Thank you, Dr. Andy. Good morning, all. Warm greetings from Maldives. Good morning, good afternoon to all distinguished participants. And thank you for giving Maldives the opportunity to share the experience of Maldives, key challenges, intervention and impact in the country on supply chain preparedness and response. The key challenges, next slide, please. The key challenges in Maldives is a country totally dependent on import of items from outside, which includes medical supplies. Hence, country requires prompt support from WHO regional office and headquarters. The supply portal-based procurement was introduced late during the pandemic, and we faced a lot of challenges, and we had number of requests from the Ministry of Health for immediate support. The other challenge of the supply portal was that we cannot check the status of the procurement requests made after validation. Status of procurement remains same without update on expected date of delivery to meet the urgent requirements in the country and plan better for delivery of those medical supplies. The portal also did not provide a specification even for simple common items. Further, delivery of items was too slow to respond to the urgent country needs. However, the cost offered was best value for money and very strategic. Funds committed for procurement of those from the supply portal were not encumbered in the budget center work plan, which sometimes resulted utilization of those funds to fulfill other urgent needs of the country during this pandemic. These were the main challenges we faced in Maldives, and our intervention on key, includes that it would be useful if a link in the supply portal is made available to access the multiple specifications developed by WHO and partners that will be required in all pandemic situations. For example, multiple specifications for ventilators, oxygen cylinders, PCR machines, etc. And further, we suggest that keeping a repository of reliable, pre-qualified products and vendors in all continents and subcontinents will be very useful in this situation. And we can also create a link of supply portal orders with financial management system of UN. That will also be very useful. And further, better explanation and display of steps after a procurement request is made in the supply portal to see the status and to inform the requisitioner will be very helpful. And we also suggest that providing options for government to place order directly for prompt support in this pandemic situation. Next slide, please. Like we see the impact, even with all those challenges, the country was timely supported in provision of many essential items such as RT-PCR test kits. And however, the delivery of some critical items like RT-PCR and GenExpert machines, ventilators was delayed and procured by the government separately in the country. Quality of these items procured was very good and cost effective. However, only the main concern was timelines are critical in the pandemic response, and we need to have more coordination with suppliers and other, which is very vital in the pandemic situation. So we would like to reiterate that with the continued support from regional office, WCO Maldives is better prepared to meet the future pandemic requirements, health emergency capacity building, and strengthened supply portal system will be very beneficial to all the countries with some suggestions we made. The Maldives has now a systematic approach towards implementing both short-term and long-term interventions and playing an important role as a catalyst in promoting these perceptions. So WCO also acknowledges the immense support, insight, and guidance received from regional office and express our special gratitude to all the colleagues in regional office and headquarters. That's all from Maldives. Thank you, and over to Dr. Adi.
Thank you very much. And again, I'm sure there'll be lots in the Q&A session, so I'll move on quickly because we're short on time today to that, and we'll come back for the Q&A session to talk in detail about that. I think the experience of using the supply portal is especially valuable for other countries to share. Our key message here is that PSM epidemic planning and preparedness works. When we undertook the survey of the 5 countries, we see that the countries with the best PSM preparedness have the best PSM response. It's an important message. PSM is not always a fully recognized area. Move the message along that it needs to be fully considered if there is to be an effective epidemic response. This COVID epidemic is not the first one. been suffered before. And if we're going to respond to future epidemics, it's clear the critical role of PSM must be recognized and PSM must be developed and made more resilient. Our health systems, public sector supply chains are weak. And any epidemic or any health challenge is going to stress them enormously. Countries in the region have generally done very well and have coped. But let's understand, unless we undertake major strengthening, being able to cope in the future and being able to cope continuously with the continuing pandemic will be problematical. Of course, making supply chains more resilient will require longer-term development, but it's essential that we start on that process and start to improve overall health supplies provision. How do we go about addressing them? We have a series of recommendations. The short-term recommendation is review commodity budgets. The cost of all health products is increasing. We're seeing that across, particularly for pharmaceuticals, but across all items, and especially transport costs are increasing. At present, sea freight is not very much affected. It's mainly air freight costs that are increasing, but transport costs must be monitored carefully. If not, we won't have enough money to buy enough medicines for the coming year. We need to start PSM planning and preparedness for introduction of COVID vaccine, which has already been well covered in earlier presentations. If you're not already well into that, it needs to move along. Longer term recommendations, many countries don't know how their PSM systems are weak. We don't have maturity assessments, we don't have regular KPI reporting, and that needs to change to identify the gaps and focus on strengthening the gaps that we have in the supply chain. Epidemic PSM planning needs to be improved. PSM needs to be an integral and critical part of all epidemic planning within the country. It's been neglected for too long. It must be there or we can never respond effectively. For commodity forecasting, lead times on all products, not just COVID-related products, have increased. You need to start ordering now for Q3, Q4 deliveries in this year. We need to increase surveillance of market conditions. Global Fund, GDF, and UNICEF publishes market reports and updates delivery times on products. We need to strengthen forecasting and the forecasting tools available, especially for COVID-19 commodity forecasting. The ESFT tool is available, but does require some knowledge and training to get the best use out of it. Longer term recommendations, extra resources, not just what's available within the ministry, but fostering links with universities and the private sector, NGOs, other who can assist, who can provide extra capacity during pandemics, extra PSM capacity. For procurement, we recommend not relying on a single mode, use multiple modes of procurement. UN supply portal system is good, but look at other systems as well. Many countries are using fast-track procurement mechanisms. That's good, but often they're not well documented and could run into problems in later financial audits. The World Bank has formulated a series of fast-track procurement mechanism documents and guides. They're a very good base and should help to establish a clear financial audit trail through the procurement mechanism. We recommend using fast-track mechanisms, but use formalized mechanisms. Strive for planned procurement using the new lead times and look at the uncertainty around supply. Increase buffer stocks as necessary. Longer term recommendations, develop local suppliers for PPEs and hygiene products, sample collection kits if possible, and look at long-term contingency contracts which can be invoked during emergency situations. Logistics recommendation, leverage the private sector and all temporary storage that might be available. Start mapping what can be available. Start mapping what could be used if required. Operation in decentralized systems is problematical. So look at some centralized distribution and storage of pandemic commodities, rather than fragment stock locations in different parts of the country. Longer term recommendations, contingency planning of storage and transport, looking at contracts which can be implemented if, lots of what if scenarios, and putting in place contracts and mechanisms which can be invoked at times of emergency. Human resources. Right now, face-to-face courses are difficult, so it's going to be online training. There are now online training courses available. Look at recruiting extra staff, not just within the ministry, but externally. Look at staff that can be brought in on an emergency basis. Looking at MIS, we heard there from Nepal how important the MIS system was in getting weekly reports on where stock is. Longer term recommendations, continuous learning and knowledge. PSM staff have a high turnover rate. It's important that we have a continuous learning and knowledge base available so that people are well capacitated and that we have other staff in NGOs, in universities, in other facilities we can draw on in emergency situations. Developing electronic logistic management information systems which can be introduced for pandemic commodities and logistics. Often our LMIS is not very flexible. We can't quickly add extra products and extra mechanisms in it. We need to look at more flexible ELMIS systems. Okay, I've gone through that quite quickly. It's now time to move to the Q&A session. You type your questions in the chat box, please, and they'll be referred to one of the experts for comment.
Thank you, Professor Andy. We have one question from the chat from Tashi Lunduk. She says he or she says about the fake and substandard COVID-related items. What would be the recommendations from WHO to get rid of those substandard goods? Is there any standard specifications recommended by WHO or standard guidelines to be followed during procurement?
Okay, I'll take that one to start and others can add to it. There is the WHO catalogue of COVID items that links to the UN specifications for those items. So the UNICEF specifications for those items. So yes, specifications for items are available. For COVID commodities, the key recommendation is secure source. Buy from a secure source. That's easy advice to give and difficult to do. If we look at the high income countries, the UK bought substandard gowns. Germany bought non-existent testing kits from an internet company that didn't exist. So it's not easy, but try to use secure source. The UN supply portal, the WHO supply mechanism works and provides good quality products, assured quality products. If any of the others would like to add to that. Nepal, I think you've experienced quality problems. Sorry, Hyun, go ahead.
Yeah, sorry, Professor. I think to just add to what Professor Andy has mentioned, there is also WHO COVID-19 disease commodity package, which has been updated also recently. That's version number 5, wherein the minimum standards of the BP to be used for the surveillance, infection prevention control, and the case management purposes are actually listed out. So anyone can actually refer the minimum standards of the BP items to be used at different levels, and they can actually refer to WHO guideline. Over to you.
Okay, Nepal, if Dr. Abin would like to comment on quality issues, since you raised the subject.
Yes, Professor Andy. Is it okay?
Yes, please, okay. Go ahead, I can hear you.
Okay, I think for the quality issues, I think like what you mentioned, we also adopted the WHO guideline, which was incorporated into the technical specification bank, which is basically a bank which incorporates the commodities, the pharmaceutical products, the equipment and everything into mentioning the kind of criteria that it needs to meet, and it try to adopt different international guidelines or international rules that needs to be followed up. So we actually initially followed up the WHO protocol to ensure the commodities that has been that can be procured. But one of the key challenges again was that how do we really ensure that once the commodities have been received in the country, does it actually match the kind of criteria that we have actually set here? Because for that, we need a testing laboratory, something like that. That was never present in our country, or not really available in our country. I think that was the main challenge in our country, because we are not able to test this kind of equipment, commodities, or things when they will be shipped to the country. Over to you, Professor Andy. That's all I have to say. Thank you.
Okay, testing of COVID commodities is particularly problematical. There are few certified testing laboratories, and the few that are available are overwhelmed by the volume undertaken. So often the inspection has to be following the WHO 3-tier system. So we start with a visual inspection, and that can often catch a lot of products. Around 60 to 80% of the quality failures can be found just on visual inspection. Then you have to go to simplified laboratory inspection, just the basics. For sterile items, are they sterile? Most in-country laboratories can undertake that kind of testing. The third stage of full compliance is very difficult to undertake, and really means sending items to overseas laboratories and waiting in the queue. But the first two items, one is visual inspection and verification of documentation. It's a fact that companies who can't make good products can't make good paper. So just by verifying the documentation, you can often catch 40 to 60% of failures. Visual inspection will increase that to 80%. Then you need laboratory testing, but use a simplified technique, just sterility testing for sterile items, and then go to full laboratory testing from there. But a lot can be caught just on documents and visual inspections.
Thank you, Professor. We also have a comment from Bhutan. Karma Wangbi has said, Bhutan has issued relaxation of the procurement rule to fast track any procurement during pandemic. It's called Simplified Procurement Rules and Regulations, almost reducing procurement time by almost 200%. For instance, normal tendering for open method is 30 days, but in simplified form, it is reduced to 10 days.
Yep, I mean, fast track mechanism, that's exactly right. Our only point around fast track mechanisms, which we fully support and we fully recommend countries to undertake, is the need for a clear audit trail. Sometimes in our rush to get the commodity, we don't always observe financial probity. So I'm just making the point, be sure that we have financial probity in our transactions. High-income countries have been caught and damaged by undertaking fast-track procurement. So care is needed, but with care, and here the World Bank documentation is a good framework. You don't have to have World Bank funds. You can use the mechanism and the documentation to guide you in your own country programs and systems. But yes, fast-track procurement can certainly help. We recommend it, but it does need to have financial probity. So for sure in the future, the audits will come looking at exactly what happened and where did the money go. And we have to be sure that we have a clear audit trail to respond to that. But yes, very effective in many countries.
Thank you, Prof. We also have another question from Dr. Ugian. He says, any pre-qualification plans for the PPEs and other items for COVID-19 in the region by WHO and other international organizations? It's almost impossible to qualify the products during the procurement based on the documents.
I'll pass that one over to WHO if someone would like to respond. I'm not aware of any immediate plans, but perhaps Ian has more up-to-date information.
Yeah, thank you, Professor. I can answer to that questions. Yes, all the items listed, including the PPEs that are listed in the supply portal catalog, these items are being procured at the headquarter level in a bulk purchase procurement. And before the procurement, all the quality assurance and quality checks have already been undertaken. So there shouldn't be any issues related to the pre-qualifications as such for the procurement done through the supply portal mechanisms. For any procurement done through the local procurements, there is also a pre-qualification exercise at the regional office level that has been conducted for the WHO country offices in terms of the quality assurance and the quality checks exercise. We are closely coordinating with the health system department and then WHO health emergency teams for reviewing the required documentations from the suppliers that are being provided for the local procurement of these PPE items. So this is internally being done. So in case if WHO country office Bhutan would like to go for the local procurement of the PPE items, definitely they can contact the procurement and contracting services team at the regional office, and also the WHO country office, WHO health emergency team, as well as and then we'll be coordinating along with the HST team for reviewing all the documentation required that has been provided, submitted by the supplier. Over.
Okay, thank you very much for that. I see we have a question about vaccines. Perhaps Dr. Sudhir could help to address that.
Yes, thank you. I'll put the information in the chat so that everybody can have it documented. I also need to share some links on the vaccine, so I'll do it in the chat. Thank you.
Okay, thank you very much.
Thank you, Professor Andy. We have a question from Dr. Victor. He says, Andy has mentioned the dependencies across the entire PSM system. How shocks caused by COVID tensions affect other non-COVID commodities? How can health systems cope with this systemic risk?
Okay, the simple way is to strengthen the supply chain. One way is, of course, buffer stocks and managing buffer stocks in different ways. Traditionally, buffer stocks have been managed by having physical volumes of stock in storage. That's problematical because of the temperature and climatic conditions in many of our countries. People tend to focus on high temperature, but low temperatures can be a problem as well. Freezing vials can be difficult as well as high temperatures. But buffer stocks can be managed with pipeline management. That is, having goods on order on transit continually and managing that pipeline. By managing the pipeline, we move some of the physical stock away from the country to be in process and having longer term contracts for supply delivery to ensure supplies. The global mechanisms which do that already, like Global Fund, like GDF, the Global Drug Facility for TB drugs, do exactly that. We need to use that more generally at country level to look at longer term supply contracts and look at better pipeline management, what's in the process of being delivered all the time, rather than focusing only on increasing buffer stocks. Next, there is strategic stocks. That is having stocks of items. PPE is not unique to COVID commodities. It's not unique to this pandemic. It's many infection control requirements. So stocks of this should be built up, should be strategically in place. That's the short answer. I could go on for a long time, but we better look at other questions as well.
Thank you, Professor. We have another question from WHO Thailand, from Dr. Poi. He says, what if the PPE passed QA of national standard, but not WHO's?
That's certainly a problematical one. If it's past the national standard, it's used in the country. The difficulty probably doesn't apply to Thailand because you don't have a lot of donor funding. But donor funding would require WHO quality standards to be observed. Since Thailand is self-funding, then national standards apply. And I don't think Thai standards are so different from WHO standards overall. It tends to be in a few specific areas.
Dr. Sudhir, would you want to tell us the document, the link that you have shared?
Yeah, I've just shared a file on the vaccines, which talks about what is the tertiary package volume and the secondary package volume, as well as the shelf life. So for the vaccine, that can be stored at 2 to 8 degrees. The vaccine can be stored up to 9 months, like the Oxford AstraZeneca vaccine or the Serum Institute of India vaccine. Well, the Pfizer vaccine can be stored at -60 to -90 degree for 6 months in the ultra cold chain. But if the thermal package is being used, it can be stored only for 30 days in the thermal package, provided that the dry ice are changed every 5 days. The secondary packaging volume of the vaccines range from 2.1 to 2.6 cubic centimeter per dose, which is half than what was initially anticipated. So I think these are a few information that were asked. What was the third one? Yeah, are the WHO PQS certified ultra cold chain equipments? Yes, there are, and it is available in the WHO PQ website. And I'll share some of those links to the catalog that people can access that. I've just done that in the chat. Hopefully that will be helpful.
Yeah, thanks, Dr. Sudhir. I think that's really useful, your answers, as well as providing us, these tangible documents and resources. That would really help. Thank you.
We have another question directed to Dr. Sudhir from UNICEF, from Nangmia. He or she says, Pfizer vaccine does not come with diluent and dry stocks. Does the same apply for the COVAX facility?
I think this is also directed towards me.
Yes, sir.
Yes, this is something that we are negotiating with the manufacturer. The COVAX facility actually envisions bundled vaccines, which means the vaccines come with the diluent if required, and as well with the syringes and everything that is required. But what we have seen with the Pfizer vaccine is that they don't come in bundles. In the PAHO region, Pan American region, UNICEF has negotiated with Pfizer company to provide diluent of 10 ml, which can be used for multiple vials. But that poses a problem of contamination, and adverse event following immunization could be high because of that. So we're encouraging the manufacturer that they provide bundled vaccine. Well, it has not happened yet. The problem is with Pfizer vaccines because the requirements are different than what is in the routine immunization. But for the other vaccines that are to be stored at 2 to 8 degrees centigrade, the syringes and other ancillaries required are same as other routine programs. So the national program would already have those, or they could use from the stock, or they could order. But for the Pfizer vaccine, this is going to be a challenge, and this is something the COVAX facility is negotiating with the manufacturer. I hope this answers. Thank you.
Okay, do we have any more questions?
No more questions on the chat. We do have a comment from Dr. Om. He says that India COVID vaccines includes syringes along with it.
That's very useful to know. Thank you. Okay, Sachin, then over to you for the polling.
Sachin, you're muted, sir.
Sorry. Thanks, everyone. Thanks, Dr. Andy, for the previous session. And also, it was really useful information which country teams from Nepal and Maldives provided. So we have a short poll here just to gather some feedback and also some ideas for the next webinar. So I request you all to take out 2 minutes and just fill this poll. Thank you. The poll should be live now on your screens. Meanwhile, another question has come in. This is from Stephanie. Would like to know period between 2 doses of Pfizer vaccine. I think Dr. Sudhir, maybe you can answer that.
Yeah, the period between the two doses of Pfizer vaccine is 21 to 28 days. So the gap should be the first dose, the second dose should be given after 21 to 28 days of the first dose. Thank you.
We just have another question there on the pre-qualification, a link. Perhaps Hyun can agree to share that with everyone, the full list of pre-qualified materials.
Yes, I will share with the link of the WHO COVID-19 disease commodity package, which I already shared earlier, but I will share again.
Perhaps
And
we
also
will send it with the PowerPoints when we email them out. Yeah.
Sure. I can also share with the WHO catalog of the supply portal
Yeah.
for the information. Yeah.
Thanks, everyone. I'd just like to reiterate that we will be sharing with everyone the recording of this webinar and any links which have been provided. And of course, we will be the facilitators contact, at least from Empower side, will be also shared so that you can channel any further questions, and we would make sure that we can get answers to them from the speakers and be provided to you in due course. So I'll just, in the interest of time, I'll just close the polling now. Thanks all for your replies. Yeah, we've closed the poll. So thanks a lot. And I think I'll just ask Dr. Victor to provide his closing comments and also tell us a little bit about GOAN. Dr. Victor, over to you.
Thank you very much, Sachin. Can you hear me fine?
Yes, Dr. Victor, please go ahead.
All right. Yes, thank you, Osman. Yeah, thank you for the honor of closing these to what I believe has been a very informative meeting. So it falls on me to come up with perhaps take-home messages and wrap up this very informative meeting. As I said, I perhaps should start by apologizing to Andy for firing a very awkward and generic question on systemic risks, but it's something that certainly caught my eye when you were describing all these cascades of events and non-COVID related impacts, and I'll come back to that in a minute. But before I share my surely partial views and thoughts on the fruitful discussions, please allow me to provide advertise once more the Global Outbreak Alert and Response Network, which together with SEARO and colleagues from Empower put together this meeting. And I'd like you to obviously to explain a little bit what is GOAN's interest in this supply chain of PSM subject. And so GOAN obviously has got an interest in improving the readiness and response to any outbreak. And normally we focus on very vertical pillars, epidemiology, laboratory, and many others that are familiar to you all. But if we look in depth into this problem, surely that you will agree with me that PSM is certainly key and provides the foundation on which many of these vertical capacities rely on. So it is obviously an obvious area of interest for GOAN. I'd like to invite you all to visit GOAN site, so just Google it and reach out to the address that is provided, email address that is provided, if you find any areas of interest or collaboration. And then now, in the interest of time as well, I see that we only got 1 minute left. and I'm sure we all have busy agendas. I just like to highlight perhaps a couple of messages that I got from Andy, and I recognize that I don't have time to cover the presentation from our colleagues in Nepal and Maldives, and also from Dr. Kanal, which I found particularly interesting, the three of them. But I just want to highlight three take-home messages from Andy's presentation. One, the lack of evidence to inform how PSM systems might be performing. Two, the lack of resilience on PSMs. And three, perhaps the most important, is that PSM preparedness works. And with that, I like to thank all our esteemed participants and speakers. I hope you had a good informative session, and then that you can join in future and forthcoming events. And please start enrolling on our community of practice, or at least as soon as Sachin shares the link. No pressure, Sachin, the sooner the better. Thank you all, and I wish you all a very nice day. Over to you, Sachin.
Thank you all. And like I said, we will be sharing the recording and other resources which have been shared by the various speakers. And we also thank you for the polling, and I see that you have given us a good feedback, so I will not get into it, and also useful suggestions for the next webinar. So we really thank you for that, and look forward to be engaged with you all through the platform. We also encourage you to take the course, which has been specially developed for this pandemic and to fight future pandemics from a supply chain perspective. So good day to you all, and you will hear more from us.